Welcome! Today, we're putting on our detective hats and cracking a fascinating case. The tiny messengers in your blood that tell doctors huge stories about your health. We are diving deep into the secret world of clinical enzymology.
Well, believe it or not, it can talk. And it does, every single day in labs all across the globe. It doesn't use words, though. No, it uses a language of chemical clues called enzymes. And today, you and I are going to learn how to speak that language.
All right, let's get into it. Here's our case briefing for today's investigation. We'll start with the basics, the chemical clues. Then we'll meet our key players, the usual suspects, if you will. After that, we'll tackle the biggest challenge in the field, look at some real-life case files, and finally, figure out how to crack the code.
Okay, first things first. Before we can solve any medical mysteries, we really need to understand our number one piece of evidence, the enzymes themselves. So what in the world are these things? Think of enzymes as your body's microscopic, super efficient factory workers. These proteins are catalysts, which means they make every single chemical reaction in your body happen on a timescale that actually supports life. We're talking over 1 million times faster. But, and this is absolutely crucial for our detective work, these enzymes are supposed to stay inside their specific cells. When a cell gets damaged, from an injury, a disease, maybe a lack of oxygen, its outer wall starts to break down. It gets leaky. And what leaks out into your bloodstream? You got it, the enzymes. That leak, that's our very first clue that something, somewhere is wrong. So now let's meet the key players. These are our usual suspects, the enzymes that doctors and pathologists are always on the lookout for when they think something's gone wrong inside the body. Okay, this is our lineup. You've got your specialists, right? ALT is a pretty clear signal for liver cell damage. Down the list, CK is a big red flag for muscle damage, while amylase and lipase point right at the pancreas. But here's where the detective work starts to get tricky. Take a look at AST. A high level could mean liver damage or muscle damage. And what about ALP? It could be coming from the liver's bile ducts, or it could be coming from your bones. This overlap, this ambiguity, that's where the real mystery begins. And that very overlap, that ambiguity, leads us straight into the central challenge of our investigation, a classic case of mistaken identity. In the biz, we call it the specificity problem. So here's the deal. The good news? Running an enzyme test is super easy and really cheap. That's the pro. The con, that pesky lack of tissue specificity. Just because you find a high level of an enzyme in the blood doesn't automatically tell you where it came from. Is that elevated AST from a strained heart muscle or a struggling liver? The clue is there, absolutely, but the source of that clue is a total mystery. Luckily, our medical detectives have a pretty cool tool in their kit for this, isoenzyme analysis. See, isoenzymes are just different versions of the same enzyme. They do the exact same job, but they have a slightly different structure depending on what tissue they came from. So by using a test called electrophoresis, which basically separates molecules by their size and electric charge, we can tell them apart. We can trace an enzyme like ALP back to its specific origin, bone, liver, intestine, you name it. It's like running chemical forensics to pinpoint the scene of the crime. Okay, theory is great, but let's see how all this stuff plays out in the real world. Let's dig into some clinical case files where these enzyme clues were front and center. So picture this. Our first case is a 19-year-old guy with some bad muscle pain. His blood work comes back, and his creatine kinase, that's the muscle damage enzyme we talked about, is through the roof. It's at 1,011, when it should be under 308. His doctor's worried it might be a rare side effect of a medication he's on. So is this some dangerous disease? So what was the verdict? It was just exercise-induced rhabdomyolysis. It's a fancy term, but it just means he had severe muscle breakdown from going way too hard. The guy had been hitting the gym every single day. After just 2 days of rest, his CK level dropped by more than half. This case perfectly illustrates a core principle here. Context is everything. Without knowing he was a gym fanatic, that number looked absolutely terrifying. All right, next up, we have a 40-year-old woman who gets referred to a specialist. Why? Her alkaline phosphatase, or ALP level, is persistently high. It's not off the charts, but it's just always elevated. So the doctors are trying to figure it out. Is it her liver? Could it be a bone disease? Is it something more sinister? So what do? They order the isoenzyme test, and boom, the results you see right here crack the case wide open. Check it out. The liver and bone ALP results, 57 and 47, are perfectly fine.
well within the normal range. But the intestinal ALP is 54, when it should be less than 18. That's almost 3 times the limit. Mystery solved. Turns out this is a totally common and harmless finding in people with blood types O and B, especially after they've had a fatty meal. The forensic test cleared all the serious suspects.
Okay, our final case is a real head-scratcher. A 22-year-old woman comes in for routine blood tests for anemia. The results come back, and her amylase level is shockingly high. I mean, a number that would normally scream acute pancreatitis, a serious medical emergency. But here's the twist. She feels totally fine. No stomach pain, no nausea, nothing. What on earth is going on here?
The diagnosis was this really fascinating rare condition called macroamylasemia. What was happening was in her blood, the amylase enzyme was literally binding to an antibody. This created a giant molecular complex, a macroamylase, that was just too big to get filtered out by her kidneys. So it wasn't leaking from a damaged pancreas at all. It was just trapped in her bloodstream, unable to get cleared out. This created a dramatic but totally misleading high number. It was a complete red herring.
So, after going through these wild cases, what have we actually learned? What's the secret to being a good medical detective and cracking the code of clinical enzymology? And this is the big one, folks. The most crucial takeaway is that a single number, all by itself, means almost nothing. That crazy high CK in our gym goer was just noise without the story of his workouts. The diagnosis isn't found in one clue. It's found in the entire pattern of all the evidence combined with the unique story of the patient sitting right in front of you. And this brings us to a super critical point. Normal isn't just one number. It's a moving target that depends on the person. First, muscle mass. Just makes sense, right? More muscle means a higher baseline CK level. It's why reference ranges often differ by sex and ethnicity. Second, age is a massive factor. A teenager's ALP is going to be sky high compared to an adult's, simply because their bones are still actively growing. Third, diet. Like we saw in our case, a fatty meal can temporarily bump up that intestinal ALP. And finally, exercise. A really tough workout can cause a huge but totally temporary spike in CK. Every single one of these factors changes the context of the clues.
You know, understanding these chemical detectives does more than just demystify your lab report. It empowers you. It helps you ask better questions and appreciate the incredibly complex, fascinating detective story that is unfolding inside your body every single second of every single day. So the real question is, what other clues are just waiting to be found?